The broadcast is now starting. All attendees are in listen-only mode.
All right, well, good afternoon, everybody. We're going to wait a couple seconds for as people are joining the webinar, and then we'll get started. Okay, we still have people joining us, so give us another few seconds. All right, well, good afternoon, everyone. Welcome to today's seminar or webinar, and thank you for joining us. My name is Sandra Berg, and I'm a professor at the UTHealth School of Public Health. I'm also the Associate Director for the Michael and Susan Dell Center for Healthy Living. And today's webinar is hosted by the Dell Center for Healthy Living. And before we get started, I would just like to make some housekeeping announcements. First of all, the webinar is being recorded and will be archived along with the presentation slides at our website, which is msdcenter.org. And if you have any questions during the presentations, please just enter them in the chat box. We have a series of speakers today, so I think it's just easier and more time efficient if we respond to all the questions at the end of the presentation. And so in today's webinar, we have 5 different speakers who are presenting on different aspects of the Fresh Awesome study, which is a study that was funded by the Foundation of Food and Agriculture. And they have, I mean, as a collaborating organization, we have worked very closely throughout the last couple of years on this. And so the FRESH study is a community-based study focused on evaluating a citywide initiative, the Fresh for Less initiative, which provides more access to healthy food in low-income communities. And the data that is being collected through this evaluation component of the study is guiding the development of an agent-based model, which will be able to simulate different food access scenarios and their impact of healthy food purchasing and consumption in Austin, Texas. And so what we're presenting today, this is an ongoing study, so this is not the final data, but we do have some really great data that we collected during COVID-19. And Aida will be talking a little bit about how we had to switch our study and really our whole study design as COVID started. But so for today's speakers, we first have Katie Jonda, who's a postdoctoral fellow at the UT School of Public Health, and she's a NCI Cancer Control Research Training Program fellow. She will be presenting some of our rationale for doing the study and some backgrounds on food insecurity. Then we have Aida Nielsen, who is our project director, and she will be talking a little bit about the original FRESH study and then our pivot to the study design during COVID-19. Then we have Yuzi and Viri, who are both doctoral students in our program, who are going to be presenting some of the qualitative data. And then lastly, we'll have Deb Salvo, who used to be at the UT School of Public Health, but now is an assistant professor at Washington U in St. Louis. So at this point, I don't want to take up any more time, but I'll hand it over to Katie to start our presentation.
Great, thank you. Good afternoon for those of you in Eastern and Central time zones. As Dr. Vandenberg just said, I'm going to be kind of providing a little bit of background on food insecurity, food access disparities, and kind of set the stage for the importance of the work that the FRESH study is doing. Next slide. So to get all on the same page, a basic definition of food insecurity is a limited or uncertain availability of nutritionally adequate and safe foods, or limited or uncertain ability to acquire acceptable foods in socially acceptable ways. Next slide. So to kind of deconstruct what that means, food insecurity typically is defined as having 4 major components and constructs. Availability, so like being able to actually have food within the community. Access, which kind of is sub-broken down into geographic food access and economic food access. So think about it as, are there retail options near where you live or work where you can purchase food, as well as economic food access, meaning is that food actually affordable? Are you able to afford to be able to buy that and to buy those items? Utilization, which is kind of a fancy word for consumption, as well as stability over time, meaning that you have consistent access and consistent availability and consistent utilization of food across time, and that there's not like cycles and trends that kind of vary. Next slide. So within food insecurity and food access, there are several noted disparities within the literature: race, ethnicity, income, urban, rural status, employment, and transportation. So what this means is that in the literature, and this is what we've been finding in the literature before COVID as well as during COVID, you can see that there are differences by these different factors. So people of color are often at greater risk of being food insecure, and they have higher prevalence of food insecurity than non-Hispanic whites within the US. For income, those who have lower income are more likely to be food insecure than those who have higher income. For employment, if you have inconsistent employment or are unemployed, you're more likely to be food insecure than those who have stable full-time employment. And for transportation, if you have access to a car, you have greater odds of being food secure, while those who do not have regular access to a car have greater odds of being food insecure. So all of these pieces kind of can affect the food insecurity as well as access. So identify as being Black or Hispanic specifically, you often have, you're more likely to have limited food access than non-Hispanic whites. And that's kind of where you get those terminologies of like food deserts and things that you think of with food deserts of not having consistent access or available access to healthy foods is really what we think about too with food access disparities. Next slide. So to put some data and numbers behind all of these trends, before the COVID-19 pandemic, 11.8% of American households were food insecure in 2017. And you can see that within Texas, it was above the national average, meaning that 14% of families in Texas identified as food insecure from 2015 to 2017. And to drill down into Austin, since that's where this study is really conducted, over 15% of families in Austin experienced food insecurity in 2016. So you can see that the state of Texas is above the national average for food insecurity, and then within Austin, it's above the state and national average. So there's definitely a need for this type of work within this community. Also, for those of you who are not as familiar with the Austin-Travis County area, it's a very diverse area. Just under half of the population identifies as white, over a third Hispanic or Latinx, about 8% Black, and about 7% Asian. And residents of the eastern crescent of Austin, which we'll talk about in a map momentarily, are more likely to have experienced limited geographic food access and food insecurity. And we'll talk a little bit more about that in a second. And these are all very important public health issues, since various health conditions and unhealthy dietary behaviors are associated with food insecurity and limited food access. These include greater likelihood of obesity, cardiovascular disease, diabetes, mental health problems, and other factors. Next slide. So here is a map that demonstrates and depicts some of the 2018 American Community Survey data. So this is Travis County, and areas that are kind of dotted have a poverty rate over 15%. The diagonal slash area zip code areas are predominantly non-white zip codes, meaning that it's predominantly people of color. And then for income, if the median income was over $70,000, it's in white. If it's under $70,000, it's in blue. And the gray areas are for they're also white and blue depending. But what you can see within this map is that the eastern sea essentially of the county has higher poverty rates, lower median income, and they're more likely to be have majority non-white populations. So you can kind of see these disparities exist since that eastern crescent of Austin and Travis County that I mentioned earlier are more likely to have limited food access and experience food insecurity. So you can see all of these disparities kind of coalescing within this geographic area. Next slide. So what does this look like during COVID? We've heard anecdotally about the long lines at the food pantries and food banks, need for school feeding programs, et cetera. And this was really all over the news last spring and early summer and continues to be a huge topic of discussion. And what we've found is that Feeding America projects that 17.1 million more Americans could become food insecure due to COVID-19. And at its peak, there were over 700,000 more Texans that were eligible and on SNAP during the pandemic than pre-pandemic. And this peak occurred around September. And then because of some of the changes in pandemic EBT and different eligibilities, kind of the numbers are declining a little bit, but they're still higher than what they were in January and February 2020. Additionally, Census Pulse survey data estimates that food insecurity prevalence in Texas has more than doubled from 2019 to November 2020, going from 14% in 2019 to just under 28% in November 2020. And that these food insecurity prevalences are even higher among households with children, as well as Black and Latino households, nationally as well as within the state. And as we've heard these anecdotes that there's been a lot of issues with food insecurity due to store level closures, lines at food banks, individual level factors such as age, pre-existing conditions, and concerns about being able to go to the stores, etc., as well as issues with transportation, among other factors. Next slide. Great. So all of this information is really demonstrated that there's quite a few gaps in the literature. Little has been known about the experience of residents in Central Texas from their own perspective about food insecurity and food access during the pandemic specifically, since oftentimes data about food insecurity is not even available for many until several years after it is measured, which is why I was referring to that 2015-2017 data at the beginning of the presentation. Additionally, the majority of literature that looks at food insecurity and food access looks solely at access to supermarkets and grocery stores or one type of food retail, let it be only corner stores or only farmers markets, rather than multiple aspects of the food environment, which we know is very complex. So this is really the starting point, and I think helps sets the stage for what Aida is going to present about the importance and the relevancy of the work that FRESH is doing, that we've done with FRESH, and how we have pivoted during the pandemic. So Aida, next slide.
Great, good afternoon, everybody. I'm Aida Nielsen, the project director of the FRESH Austin study. So I'm going to really briefly talk about the overall of the study before kind of diving into the sub-study around the COVID data. Next slide, Kate. So as Dr. Janda mentioned, food insecurity is a huge problem nationally, at state level, and definitely also at the local level. And to address that, the city of Austin in 2016 passed a food policy that allocated almost $500,000 in annual funding to implement a comprehensive multi-sector healthy food access initiative. The goals of the initiative were to increase both the geographic and the economic access to healthy foods, with a strong emphasis on fresh fruits and vegetables via 3 nonprofit organizations: Sustainable Food Center, FarmShare, and GAVA. SFC was going to do work around farm stands, which sold local, organic, fresh fruits and vegetables at a low cost. FarmShare was doing mobile markets that sold fresh fruits and vegetables, organic, low cost, but they also had some staple food items like eggs, honey, peanut butter, pasta, and GAVA was going to do work around healthy corner stores. Next slide, please. So how we came to be is SFC received a grant from the Foundation for Food and Agricultural Research, and we were subcontracted to do an evaluation of the Fresh for Less initiative. And really, we hypothesized that the geographical proximity to the mobile markets and farm stands would result in higher purchasing of fresh fruits and vegetables and therefore higher consumption. And another thing that we are doing is somewhat of a novel approach with this agent-based model. It was really it's going to be a tool for policymakers to test different strategies under expansion scenarios, and these strategies being the food mobile markets and the farm stands. And we're also going to see if we can kind of predict healthy food purchasing and consumption. And the agent-based model is going to use the data that we're collecting. And so in 2018, when the study started, we recruited 400 participants to be in a 3-year study, and we were going to survey them once a year for 3 years, starting in November 2018. So the first year, the baseline year, ended in March of 2019. And the second year they took the survey was November 2019 through March of 2020. Next slide, please. So we just wrapped up, like the very beginning of March, when things were still kind of, what is SARS-CoV-2? Like, is it going to be big? Is it a 2-week thing? Like, what's happening? So we just finished. And when we finished, a few days later, the city of Boston passed a ordinance saying that 250 persons or more should not gather. A few days later, that came down to 10. Schools closed. Anecdotally, food purchasing has changed. I mean, when we were speaking in meetings, and so we thought, can we do something to explore these associations between kind of sheltering in place and food behaviors with our cohort that we've just finished surveying for the second time around. So we went to SFC, we went to our funder, FFAR, created a whole survey around COVID, which got approved end of May. And as soon as it got approved, we started surveying participants for COVID2. And we were going to do one COVID survey kind of like in the earlier pandemic, and we also approved another survey for later in the pandemic. And so this later in the pandemic is kind of what I will be discussing. Next slide, please, Kate. So the cohort participants were contacted. They took the survey kind of June and July of 2020. It was 367 people. Whoever took the survey received a $20 gift card to Amazon or Walmart. All the surveys were obviously online. The cohort participants were, there was also a section in the survey that said, if you can refer someone to take the survey, please do so. They were going to get a $5 gift card if the referred person took the survey. And so we wrapped up that data collection in July, and then about 5 months later, we started the second round of COVID surveys in December 2020, and we finished in 2021, and our total N was 304 participants. Next slide, please. I just wanted to discuss demographics briefly with this, who was our cohort, who took our COVID surveys, right? Our youngest person was 18, our oldest was 84, the mean age was 43. Most survey takers were female, about 83%. 57 were identified as Hispanic, 28% identified as white. Also wanted to share with you the annual household gross income in 2019. And as you can see, just a little over half of our population respondents made $45,000 or less. And so $45,000 doesn't go very far in Austin, and especially if you have more than one person living with you, and 80% of our respondents are living with somebody. They have one or more children in their household. I think around only 37 individuals out of these 300 said that they lived alone. Next slide, please. To go back to food insecurity, we asked sort of 6 questions with a 2-item screener, which was, we worried whether our food would run out before we got money to buy more, agree, disagree, neutral, whatever. Neutral are, we also asked the food that we bought just did not last and we didn't have money to get more. And these 2 questions were prefaced with, think back before the pandemic, these 2 statements, and then think back at the start of the pandemic, these 2 statements, think back last month, these 2 statements. And as you can see, 34% of the respondents were classified as food insecure, so sometimes or often food insecure. And at the start of COVID, that kind of shot up. 11% more identified were food insecure. And then at the last month, the numbers went down to 37%, but never really made it to the pre-pandemic levels. So as Dr. Janda said, this is kind of the trend that's also seen nationally. So it's not unique to Austin by any means. And to point out the ethnic differences in food insecurity, as we've seen, also in our population, 60% of Hispanics were reported being food insecure at the start of COVID, compared to 24% white. And just said differently, Hispanic respondents had 4.6 times the odds of being food insecure compared to white respondents. Next slide, please. We also asked about food assistance and how they were able to get food. Most people went to a grocery store in person. That's how they were able to get food. There were some doing curbside pickup, some were doing delivery. As far as free food, people around like 50 respondents said that they went to school or were able to get meals. They went to a food bank. They used their friends as a way of getting some food. And again, there was a difference in race ethnicity as to who used those services, right? With out of 50 respondents who selected school, 44 identified as Hispanic. Out of 64 who went to a food bank, 54 identified as Hispanic. And we had only about 39 people who selected friends, and 19 were Hispanic, 11 were white. And compared to the first 3 months of COVID, we asked how often have you used a food pantry or food bank? 16% have actually increased the usage from the start of the pandemic, which is quite a bit. And so you can see that we have quite a bit, like 30% of our respondents have used a food bank. So it really kind of goes to show you that it's valuable in the times of pandemic and before. The food banks are very much needed and very much utilized. Next slide, please. Kate, thank you. So with the second COVID survey, we were able to see how people's food insecurity status changed from the start of the pandemic. And we had about 58 questions on this survey. So we were also able to see some other really great information, and it kind of allowed us to expand our substudy even more by doing some qualitative interviews, and which is actually what my colleagues will speak to next. But the first thing will be Yuzi, who will discuss some other concerns that we were able to capture with our survey. So thank you, and I'm going to pass it on to you, Yuzi. Thank you.
All right, thank you, Aida. So good afternoon, everyone. My name is Yuzi. I'm the research assistant and doctoral students in UTHealth School of Public Health. So I'm going to talk about concerns among Central Texas residents during the COVID-19 pandemic from the COVID-19 sub-studies from FRESH. Next slide, please. All right, so in both the survey, so we have one last question for the COVID survey. We asked participants to please share your greatest concern at this time, or any other thoughts you would like to let us know. So in the survey one, which was conducted between June 2020 and July 2020, we have 282 people out of 367 people who took the time to answer the qualitative questions. So which gave us a 77% of the response rate. In the survey two, which was conducted between December 2020 and January 2021, we received 182 responses for this one out of 303 people. The response rate was 60%. So just a reminder, for both survey, we have like 58 multiple choice questions before the last open-ended question. So we would really appreciate that our participants took the time to answer this last open-ended question even after this quite long survey. So what were the greatest concern among Central Texas residents during COVID-19 pandemic? So let's take a look at our results. Next slide, please. All right, so in this figure, we have all responses from the participant and were coded and categorized into 13 concerns that you can see that shown in the x-axis. So we have COVID-19, health, normality, financial, employment, childcare, social interaction or isolation, food-related concerns, transportation, education, national stability, elderly care, and veterinary care. So the blue bar indicates the COVID survey 1 and the orange bar indicates the COVID survey 2. So you can see the differences in the percentage for each concern for the survey conducted in 2 time points. So the top 5 concern in the COVID survey 1, we can see that 56.5% mentioned COVID-19 and 25.7% mentioned financial, 24.4% mentioned health, 22.5% mentioned childcare, 19.9% mentioned employment in the survey 1. The top 5 concern in the survey 2, we can see that 41.2% mentioned COVID-19, 19.8% mentioned health, 13.7% mentioned normality, 13.2% mentioned financial, and 12.1% mentioned employment. So most of the cited concern had a higher percentage on the COVID survey 1 than COVID survey 2, because you can see that most of the blue bar, they are higher than the orange bar. But the greater percentage for normality was mentioned in the survey 2. And you can see elderly care and veterinary care was not mentioned at all in the survey 1. So the top 1 concern was COVID-19 in general for both surveys. So that's why we further break down the COVID-19 category into several subcategories. Next slide, please. So in this figure, we can see the concerns regarding the COVID-19, and we have 7 subcategories in the graph: getting sick, family safety, spreading the disease, lack of collective actions, vaccine, deaths, and availability of testing. So again, the blue bar indicates the COVID survey 1 and orange bar indicates the COVID survey 2. And family safety were consistently being the most cited concern regarding the COVID-19 survey, but the percentage were both decreased in the COVID survey 2. Spreading the disease and lack of collective actions was less cited in COVID survey 2. Vaccine was getting higher attention in the survey 2. You can see that 7.1% mentioned in the survey 2 compared to only 2.5% mentioned in the survey 1. While the testing availability were not mentioned at all in the COVID survey 2. So from the first 3 months of the COVID-19 for the 6 months after the pandemic, the Texas resident concern had changed, but getting sick and family member safety were always the greatest concern throughout the 6 months. Next slide, please. So here, I'm gonna share some of the quotes we have from the survey. So the first participant put, it worries me when I see people wearing masks with their nose not covered or gaping openings on the sides. I'm also concerned that a lot of people will voluntarily get a COVID-19 vaccine when it becomes available. So it indicates the lack of collective actions and the concerns about vaccines. And the second participant said that my child isn't getting enough normal social interactions and I'm not getting social instigation to exercise that I once did, meeting friends or exercise. But we also have something different in the response. They're more like a positive side of how people dealing with the daily life change due to the pandemics. And this is what participant put here. We are all in this together and it sucks. And yeah, spending time with my loved one and having time to cook more have been the most positive side, have been the positive part of all of this. I've learned to bake sourdough bread and take online cooking classes. I have also baked more cookies and cakes relevant before and don't eat bread or gluten before. But I started swimming and I think I get more sleep because no commute. My weight has stayed the same, so I'm feeling good about it mostly. So moving on to our conclusions. Next slide, please. So COVID-19 was the most cited concern 3 months and 6 months into the pandemic. Vaccine was cited more on 6 months into the pandemic. And we noticed that people are trying to adapt to a new daily routine, stay healthy and positive. So my colleague Viri will next discuss more details about the food-related behavior change during COVID-19 from our qualitative interview. So I will let Liri take over, and thank you.
Thank you, Yusi. Good afternoon, everyone. My name is Viridiana. I'm a graduate research assistant for the Fresh Austin Study and a doctoral student. I will be discussing the qualitative interviews that were conducted post-survey for the COVID-19 sub-study. Next slide, please. In addition to the surveys, we conducted qualitative interviews to get more in-depth information about food access, eating, shopping, and food purchasing behaviors during the COVID-19 pandemic. The goal was to collect 85 qualitative interviews. From December 2020 to date, we have conducted 64 qualitative interviews via telephone in Spanish and English. However, as of today, we have analyzed 54 interviews. From the 54 interviewees, 47 participants were female and 7 male. 2 identified as Asian, 31% as white, and 67% as Hispanic. Of these 54 interviewees, 31% classified as food secure before COVID-19, 32% as food secure, and 37% as newly food insecure. Next slide. Thank you. Of the 16 participants who reported to make more than 65,000 or greater, 13 classified as food secure. Majority of the participants who reported to make between 45,000 to 65,000 were under the food insecure before COVID-19 category. Of the 16 participants who reported to make between 25,000 to 45,000, majority were under the newly food insecure, and for those who reported to make 15,000 to 25,000, they were equally in the newly food insecure, and food insecure before COVID-19 category. Next slide, please. Among those interviewed, 17 participants were newly food insecure. Some of the participants expressed financial hardships, which resulted in some using food banks, decreasing their grocery budget because items in the market were too expensive, or due to the decrease of hours at work. Majority reported than before COVID. Participants reported to buying frozen fruits and vegetables, beans, rice, lentils, because they were scared that the market would run out of food, and because these items were more would last longer than fresh produce. While majority of the participants continue to purchase in-person shopping, some reported to use curbside pickup as a COVID-19 precaution. And here is a quote that one of the participants shared during the interview. "We spend less money on food than before. I avoid buying meats because they are very expensive and working hours decrease." Next slide, please. Among those interviewed, 17 participants were food insecure before COVID-19. Participants in this category expressed experiencing financial hardships resulting in late payments, canceling services, seeking help from low-income programs, and more likely to use food banks when compared to the newly food insecure and food secure category. Participants were likely to continue doing in-person shopping, use curbside pickup as a COVID-19 precaution, and go to smaller stores to avoid exposure to a lot of people. When compared to the other 2 food categories, cooking more at home and fruit and vegetable consumption was the highest among this group because they reported cooking with healthier ingredients and to also help improve their immune system. A participant during the interview shared that, "Now I have to cook more healthy food because my children are at home, and all the meals I prepare are from scratch with healthy ingredients." Next slide, please. Among those interviewed, 20 participants were food secured. When compared to the other 2 food categories, participants under the food secure category were less likely to experience financial hardships, and this could be as majority of the participants in this category made more than $65,000. They were also less likely to use food banks, increase the amount of groceries they purchased, were more likely to purchase fresh produce than non-perishable goods when compared to the other food categories. A participant expressed this during their interview. "My husband works fewer hours than before the pandemic. Now we do not go out to restaurants, walk in parks, or visit relatives. We were very stressed because we could not visit a relative who died in Mexico, but they didn't die from COVID." Next slide, please. Whether categorized as food secure, newly food insecure, or food insecure before COVID-19, interviewees had had similar behavior changes. Many of them expressed cooking more at home because they were more people at home, either doing virtual learning or working remotely. Their eating habits also changed more as more people were having fresh cooked meals as opposed to takeout. Many increased their fruit and vegetable consumption to improve their immune system. Among participants under the food secure category, they were more likely to buy in bulk when compared to the other two categories. And that concludes my presentation. Now I'll be passing it on to my colleague. I think Katie will be presenting on behalf of Deb.
Yes, thank you. Unfortunately, Dr. Salvo had a small emergency come up, so Dr. Vandenberg and I will be presenting some of her information. So something that's really important and different, I guess you could say, about the FRESH study is the utilization of novel methods to understand the spatial dynamics of food access before and during COVID-19. Next slide. So to kind of rewind back to the beginning, I talked about the various constructs that are included in food insecurity, with food access being one of them. So food access has 5 different dimensions. They have 5 different components within 3 different dimensions. The 5 different components are affordability, availability, accessibility, accommodation, and acceptability. Conveniently, all A's. What a great alliteration. And those 3 components are three dimensions are economic dimensions, spatial or geographic dimensions, as well as sociocultural dimensions. And I think that often both researchers and policymakers try to simplify and put food access in a box, so to speak, to its spatial or geographic dimension, often thinking only about availability of food stores as the key action and thing that needs to be changed in order to improve food access. However, this study employs a wide array of methods that we've heard a lot about. Our quantitative methods, qualitative interview methods described by the last 3 colleagues, and in order to understand how food access influences food purchasing and intake among residents of the Eastern Crescent of Austin that I highlighted within that map earlier. And in the next few slides, I'll be describing some of the additional methodologies utilizing GPS data, and then Dr. Vandenberg will continue with some of the agent-based modeling methodologies employed by our study to further deconstruct and understand the way in which multiple dimensions of access influence food purchasing and intake patterns, and how the food access system was disrupted during COVID-19. Next slide, please. So, first, we're going to talk about utilizing and using GPS and GIS data to understand spatial food availability and accessibility patterns. So for those of you who are not as familiar with GIS, it's Geographic Information Systems. And this methodology is pretty important in terms of and helpful in characterizing the spatial distribution of food outlets. And if used alone, it can be used to generate static, participant-centric spatial indicators of access. And it is often assumed that spatial and geographic access to food is only determined by a participant's home location. So you may see this in the literature utilizing buffers, either those concentric circles of distance, a certain prescriptive distance, let's say a quarter mile, a half a mile of a circle around an individual's home to see what kind of lies within that circle, or utilizing network buffers, which accounts traveling by street, sidewalk, etc., those same distances, and seeing what types of food retail, specifically often supermarkets, reside within each of those buffers. Then on the alternative side, this geographic positioning systems, or GPS monitors, can collect spatially and time-stamped data. And if used in conjunction with GIS data, it can allow for the characterization of complex spatio-temporal patterns of food access. It does not assume that geographic access is only relative to the home location, and can kind of consider the full activity spaces. So not just those distance constrained areas from where you live, but also kind of sees how you interact with your overall community, which is incredibly important when thinking about food access and purchasing behaviors. Next slide. So using GPS and GIS data to understand spatial food availability and accessibility patterns, we have this image from Percho et al. From Health and Place in 2013, which uses examples of, you can kind of see based upon the size of the circles and within this network kind of diagram, the time spent by the individual at home, at work, at the various different types of locations, whether it be a restaurant, a bakery, physical activity spaces like swimming pools, tennis, etc. And you can kind of see these nodes and how they exist between work and home, specifically that supermarket. Which I think does a great job of kind of demonstrating and depicting all the different places that you interact with in a week per se. So with this specific analysis, we geocoded, meaning that we mapped the specific locations and all the different types of food stores and restaurants in Austin, Texas, utilizing City of Austin food environment analysis data. And we also geocoded and mapped participants' home addresses. At baseline, a subsample of participants wore time-matched accelerometers, so physical activity measurement devices, as well as GPS monitors for 7 days. GPS accelerometry and GIS data were integrated and analyzed to do a variety of things, including identifying number and duration of confirmed visits to various food access points within the community, as well as determine if trips to and from these food access points were from home or to home locations. And what was found was that the majority of visits to food access stores do not originate from home, but most end there. So that's really important to think about how this is different from what we are conceptualizing food access within the literature. So now I think that Dr. Vandenberg is going to handle the next couple slides, and discuss more specifics about our agent-based modeling.
Yes, thank you, Katie. So in the next 2 slides, I'm going to discuss the 2 agent-based models that we are creating using the data that were collected, or that we have collected via our quantitative surveys and then also our interviews. And at this point, I want to just acknowledge the person who's actually doing all this modeling for us. And his name is Pablo Lemoyne. He's actually lives in Colombia and has been working with us since we got this funding to, first of all, teach us about agent-based modeling. For me personally, it was something I've never done before. But he's been very, very instrumental in how we have developed our surveys to make sure he gets the data that he needs to develop these models. And it's really, really an iterative process, and it has been. So there are 3 steps in creating an agents-based model. So we have, first of all, we have model development, then we do model calibration, and then scenario testing. In terms of the model development, I first have to develop the environment, which would be like the food environment. It's really, since we are doing Austin, Texas, it's the food environment of Austin, Texas. Then secondly, and we did it pre and post COVID. So we created 2 different environments because we also will be creating 2 different models. Then secondly, once you have the environment developed, you populate that environment with agents. And the agents in this case are the simulated people that live in Austin. Then thirdly, you develop the rules of the behavior. So we currently are really focused on food purchasing and food consumption patterns and behaviors. So what are the rules? And I'm going to just give you a little bit of example of that in the next slide. But what are the rules? How do people behave when they purchase food? How do they behave? How do they decide what they're going to eat? So that's mostly based on, again, some of our data that we collected ourselves, but then also data that's already available. So once you've created the model, then you have to calibrate it. And really, the question is to how well does the model predict the current food purchasing patterns and food consumption patterns? Again, does it fit the data that we're collecting? And this is I've learned, very time-consuming process, and it's very iterative. You keep on doing it by changing different small agents. You find the environment a little bit better. We've created different rules to make it fit better. It makes more sense. But this is an iterative process until a close representation of the reality is achieved. And at that point, we can do the cool part, which is scenario testing, and which is the whole purpose of creating these agent-based models. So what we want to do is look how different food access policies affect how people purchase their food, and then ultimately how do they consume food. So for example, since we're working for Fresh for Less, which again is a City of Austin-based initiative, big part of that now is having mobile food trucks that go to different places in Austin, low-income communities. These are run by FarmShare, and we have several of them that move throughout the week. Well, what if we doubled those? How would that affect how people in those communities that live around these new food assets, how do they purchase their foods? Does it change how they eat? So you can really start predicting potential impacts of scenarios, which you normally could not do using traditional epidemiological approaches. So it's a really cool way of looking at the potential success of different policies or just different changes in the environment. And then, try to select the best ones that are going to be most successful. So next slide, please. So in terms of our pre-COVID model, we had a set of 4 rules, which include that agents want to shop close to home, agents want to save money, agents want to save time, and then the cultural background influences food preferences. So that, for example, we are really finding, and it's also in the literature, that Hispanics in general tend to consume more fresh fruits and vegetables than other ethnic groups. Once we started working our COVID-19 model, an additional rule that we also included is that agents want to avoid COVID-19 risk. So there's potential for more home deliveries, curbside pickup, things like that. Also, what we have found is people are making fewer trips to the store. So they may still buy the same amounts, but they want to be exposed less, so do have fewer trips. So our initial results, the calibration phase, so the second phase that I mentioned in the previous slide. And I just want to say here, we have done about 6 different versions now. And again, these take a lot of time to run. So this has been a very, very iterative process, like I mentioned earlier. But currently, our model is predicting vegetable purchasing and intake relatively well. We did find that the model is underestimating the use of supermarkets and overestimating the use of convenience stores to purchase fresh fruits and vegetables. So we are having to make a change in that. And we'll be including a new rule, which is that agents want to shop at places that offer a high variety of food and non-food items, and that they also have non-food items and services available. So really what we're finding is that most people prefer to purchase foods at supermarkets because there are a variety of services in addition to just buying a high variety of food. So we are currently running another version of our model, and hopefully this will come closer to what we're seeing in reality. So ultimately, again, the reason why we're creating these models is that we really hope that these simulation results can help inform local policies and programs to improve food access and reduce food insecurity among Austin residents. And then, of course, particularly among those residents who reside in the areas where our study takes place, which is low income, predominantly minority areas, such as the Eastern Crescent in Austin. So next slide, this was the last slide. And so we want to thank y'all for attending this webinar. And if there are any questions, please, again, feel free to put them in the chat box. And we can start looking at those right now. I think we have about 5 to 10 minutes left. Okay, so yes,
Sorry, I was going to interrupt you, but I think you were going to read the question in the chat box.
I am going to read the question. Thank you. How were interviewees chosen for the phone interviews to collect the qualitative data represented? I noticed a lack of representation for Black individuals or individuals that would fall under other.
And I'm happy to take this, but please, Sandra and Katie, chime on in. So we actually categorize people as food secure, food insecure before COVID, and newly food insecure. And then we randomly chose participants that fell in one of those three categories. Now we collected we interviewed about 68 individuals, but only analyzed data for about 54, I think Viri said, or 53. So there may be Black individuals in there that we just haven't analyzed. But because our entire sample was 18 individuals, so like 6% of our cohort was Black, I think that would relate to about two individuals that were Black. And so we probably have that in the data that were not analyzed. But the fact that we have more Hispanic and white is just reflective of the makeup of the county.
Yeah, and I just want to add to that. So what Aida is saying is that our qualitative, the people we chose for our qualitative interviews were people that also participated in our cohort. And the original cohort, we went through a very, let's say, complicated design to collect or to recruit people that as randomly as possible. So yes, we have fewer African Americans in our sample, and I think that is started with our very, very first recruitment phase, in which there were just fewer African Americans living in the areas that we were recruiting from. So it's not by design. It's just, again, we tried to do this as randomly as possible, and that has just had, kind of like implications for all the other data collections we've done since our very first data collection in 2018.
Just to quickly add, though, I believe it's very close to what the composition is for the county. So I think that we have between 6 and 7% of our overall cohort sample identifies as Black or African American, and it's between 7 and 8% for the county. So it seems underrepresented, but it's rather representative for the county demographics and composition currently.
Thank you. Okay, next question I see. I am just wondering, well, hold on, I just lost it. Let me go back up. I'm just wondering, why are those individuals of color so food insecure? Do you foresee that this will change for individuals of color? It's a great question. Katie, I'm going to let you start out answering, and I'll
Sure. I think it's really important when we think about food insecurity to understand that issues of food insecurity also coalesce and congregate around with other issues associated with poverty. So differences in financial inequalities, housing issues, rent assistance, all of these things. And I think that there are some really interesting perspectives that are considering food insecurity as a ramification of structural violence and racism. And that is why one of the ramifications of structural violence and racism, and that's why food insecurity prevalence is higher among communities of color within this country. And I think that that notion has some really strong preliminary evidence behind it. And I think that it's something that when we as a society have a better understanding of the work that we need to do for racial reconciliation and to address some of these underlying disparities and socioeconomic differerances that are legacies of past policies, whether that be redlining or other issues that kind of first geographically congregated communities and colors and restricted them to live in certain areas of cities, and that those areas also happen to be food deserts, and that is associated with higher prevalence of food insecurity. I think the more that we think of these as structural factors the more hope that we have at reducing those disparities. So I've seen some really empowering and hopeful literature coming out of trying to design very culturally appropriate interventions that are trying to get at some of these underlying issues. But I hope that with a wider social safety net, some of these disparities, from a policy level, that some of these disparities could also be mitigated. A great question. It's very complicated.
Yes. Yes, we could do a whole series of seminars on that question. One of you asked if we can share our survey. We are very happy to share our survey. You can either email us at one of the emails that are listed here, or it's maybe possible to send out the survey on the website or something like that. But yes, we are definitely very happy to share our survey. Another question, do you believe that the study could be adapted in areas with higher rates of minorities and poverty, like the Rio Grande Valley in South Texas? I'm not sure if the question is specifically to the data collection or to the modeling, but I would say the answer is yes to either one. If you are referring to the modeling components of the study, that is specific to a certain area, a region, but the same methodology can be used. We would just have to create an environment based on, the Rio Grande Valley, which is going to be different than Austin, right? We have a different food environment here than you would have down there. So that is something that would be different. The agents would have to be different, but the whole methodology certainly can be adapted to any area in the United States or anywhere for that matter. Let me see.
I'm seeing some specific questions about if these types of studies are occurring in Houston or Dallas or other specific regional areas. I think that there are some that are trying to improve food access and food insecurity definitely within both of those communities, but I'm not entirely certain of one also utilizes agent-based modeling approaches, as well as with geospatial, with qualitative, with quantitative. So I can't guarantee that. But Sandra, do you have any ideas?
No, I'm saying I do know there's does seem to be quite a few places where people are collecting data in terms of food insecurity, especially after COVID has happened. And in general, we see the same trends as we're seeing in our studies. There are other cities where some of the agent-based modeling is being done, but not necessarily in I don't know any other places in Texas where they're doing it.
Yes. Also, a quick question that I know we can answer quickly because we're running out of time is about whether this data and information will be shared with grocers, convenience stores to improve access issues identified. Between this research team and other research initiatives that various members of this webinar are on, we have really strong relationships with the City of Austin and the Austin Travis County Food Policy Board, as well as some of their various initiatives such as the Healthy Corner Store program and potential collaborators within grocery store communities and business enterprises. So we have a pretty strong dissemination plan within that to make sure that our findings are being shared widely within the community.
I think we have reached our 1 hour time limit. I know there are some other really good questions and we are happy to answer those. Normally what we do is we collect all these questions, write up the answers and then send them to people. So we will do that for this webinar as well. So just want to thank everybody for joining us and have a great rest of your day, a great rest of your week.